Hi guys, welcome back. In my last video I covered upper quadrant stretches intended to help alleviate neck and upper back tension. Hopefully you had a chance to give those a try. This section we're going to cover lower quadrant stretches intended to help alleviate low back, hip, and or general leg tightness. Keep in mind there's so many different ways to do these stretches. I'm just going to cover a few that I think would be best performed in a work and or home setting. So let's get started. The first muscle we're going to talk about is your hamstring. Your medial hamstring consists of the semitendinosus and semimembranosus. The medial hamstring is involved with hip extension and flexion and internal rotation of the knee, while your lateral hamstring, the biceps femoris, is involved with flexion and external rotation of the knee. All three of these muscles originate at your ischial tuberosity and attach to either medial or lateral aspects of the knee. Now let's take a look and see how hamstring tightness can affect your lower back. A muscle knows how to do one thing, and that's shorten. So if the hamstrings were to be in a shortened position or a tight position, that would cause relative posterior rotation at the pelvis, which would then reduce the lordotic curve in your lower back, resulting to what we call a flat back posture. So the first way to stretch is called the seated hamstring stretch. Sitting on any stable surface, you're going to scoot your bottom towards the edge of the table. Say we're trying to stretch the right side. You're going to extend your right leg straight in front of you. This next step is really important because I don't want you to strain your back. So I want you to keep your back nice and elongated. Think about hinging at your hips and you're just gonna lean forward. You should feel that stretch going down your right hamstring. Now, for whatever reason, if you start to experience any radicular symptoms, numbness or tingling, what you can do is turn your foot out, maybe angle it like 1 o'clock, and repeat the same thing. Back nice and elongated, hinge at the hips, lean forward. I would hold this stretch for 30 seconds, and then slowly come out of the stretch and repeat it 3 times. This is a really good way to stretch your hamstrings because you pretty much can do it anywhere you are, sitting on any stable surface, any location, any place. The next way to perform a hamstring stretch is standing. Again, similar to the first one, this is also a very convenient way for you to stretch your hamstrings. Using any stable surface, I'm using a chair here. Say we want to stretch the right leg, extend the right leg and place it up on the chair. Keeping your back nice and elongated. Again, hinge at your hips, don't bend at your back. Lean forward. And you should feel a stretch in the right hamstring. Hold for 30 seconds, and then slowly come out of the stretch. Again, if you start to feel any radicular symptoms, numbness or tingling going down the leg into the foot, angle your foot out towards 1 o'clock. Repeat the same thing. Back nice and elongated, hinge at the hips, lean forward. And then hold for 30 seconds, slowly come out of the stretch. The most important thing with this one and the first one to keep in mind is that you're always using your hip as a hinge point versus bending at your back. You shouldn't feel any strain, any tension in your lower back. You should primarily feel everything in your hamstring here. Potentially you could feel a little bit into your calf if your calves are tight. The third and last way to stretch your hamstrings is in a supine position or while laying down. For this variation of the stretch, you'll probably need to use a towel, belt, stretch strap, rope, anything that you have that you can strap around your leg. So I'm using a belt that I've just looped around here. I'm going to place that loop around my right foot. My opposite leg will stay bent just to reduce any pressure to my lower back. You're going to use your arms and slowly pull your leg up till you feel a stretch in your hamstring. You also might feel a little bit into your calf if your calves are tight. You can intensify the stretch by taking the opposite hand and pushing down on your distal leg. Hold for 30 seconds, and I would repeat it 3 times. If you are able to get to about 90 degrees and you're like, I'm really not feeling much of a stretch, you can slowly straighten out your opposite leg and then apply pressure. 30 seconds, repeat it 3 times. There's so many different static and dynamic ways to perform hamstring stretches. The 3 that I showed you I think would be practical in any home or work setting. Give those a try and let's see how it goes. The next muscle group we're going to discuss are your hip flexors. The hip flexors include your psoas minor, your psoas major, and your iliacus, collectively known as your iliopsoas. These muscles are involved with flexion of the hip. You also have your quadriceps femoris, which is involved with hip flexion and knee extension. Similar to how the hamstrings, when in a shortened position, can cause a posterior pelvic rotation, shortened hip flexors can cause a relative anterior pelvic rotation, which then increases the lordotic curve in your lower back. One of the ways to stretch your hip flexors is in the half kneeling position. So I want you to get in a similar stance. The side that you're stretching would be propped up on either a couch or a chair. And you can have a stable surface nearby just to hold on to if you were to lose balance. So in this position, I want you to take your hips and tuck them in, just to reduce any pressure. And what this does, it also gives you a greater stretch in the front of your hip. So now, maintaining the posterior pelvic tilt, you're going to lean forward. And you're going to feel a greater stretch in the front of the hip and a little bit into your quads too. Hold for 30 seconds. And then slowly come out of the stretch. And you would repeat that 3 times on each side. Say you wanted a greater stretch in the quads as well. So same thing, posterior pelvic tilt, lean forward, and then you're going to take your left hand and you're going to try to bring your heel towards your bottom. And this is just going to intensify the stretch a little bit more into the quad. Hold for 30 seconds and then relax. It's really important to maintain that posterior pelvic tilt and keep your core engaged just to avoid any excessive pressure to your lower back. When doing the hip flexor stretch, you want to make sure that you're not overextending or overarching your back. So when you engage your core, you're preventing that from happening. So this next one is called the pigeon stretch, and you'll see why. So what I want you to do is, this stretch is such an effective way to open up the hips, but it's also a really good way to stretch the glutes on the opposite side. So your right leg, you're going to cross in front of you, and the left leg, you're going to extend straight back. You want to make sure that your hips are pointed forward and you're not rotating out to the side. Keeping this position, you're going to hinge at the hips and you're going to slowly lean forward. You'll get a really good stretch in the right glute and a greater stretch in the front of the left hip. Hold for 30 seconds and slowly come out of the stretch. You can angle the position of the right foot depending on where in the glute you want the stretch. So if you kind of bring it more at a 90-degree angle, lean forward and then try to come down even more, you'll get a greater stretch in the back of the right glute. Again, 30 seconds. And then slowly come out of the stretch. And then you can repeat the same thing on the other side 3 times. So that was hamstring and hip flexor stretching. As you can see, tightness in one or the other can alter pelvic positioning, contributing to lower back pain. There are also other muscle groups in your lower quadrant that can contribute to general tightness in the low back, hip, and leg. Please continue to the next video to watch those stretches. Again, remember, if you develop new symptoms or have a flare-up of pre-existing symptoms, please consult a trained healthcare professional before you continue.